So this is a short video giving top tips for answering calls from clients with PTSD. So firstly, to understand what PTSD is, we need to know what trauma is. And trauma is defined as a deeply distressing event that has been life-threatening to yourself or others around you and overwhelms an individual's ability to cope. But not everyone who experiences trauma goes on to develop PTSD, because PTSD is when the impact of a traumatic experience is still affecting the person's life months and even years later. It stands for post-traumatic stress disorder and has 4 key symptoms, which are 1. Re-experiencing moments from the trauma as if they're happening again in the here and now, in flashbacks or nightmares. 2. Feeling very on edge and hyper alert for danger, which may be difficulties concentrating, may feel very anxious and stressed. 3. Avoiding thinking about the traumatic event or any external reminders that might trigger memories and bring it back, the memories. And 4. Feeling low in mood, hopeless and blaming yourself for the trauma. So overall, if someone has been abused by people in the past in a traumatic event, they are likely to struggle to trust people. And this can mean they may seem scared, anxious or angry when speaking to a professional on the phone, which may be things you experience. So now, thinking about how to help with this. If you have a call from a client who is feeling very distressed and scared, it's important to firstly establish what is happening. And if they are not at risk now, try reassuring them that it's okay and you're here to help them. Ask them to take some deep breaths with you. And people may find themselves back in the past replaying the trauma memories, so it's important to orient them back to the present by asking them to name 5 things they can see, 4 they can touch, 3 they can hear, 2 they can smell, and 1 thing they can taste. And getting them to think if there's anything else that normally helps calm or soothe them that they can try. And then, if a client is feeling very anxious to speak to you, it's important to encourage them to take your time and reassure them that you know it is hard to speak to someone new and that you are here for them. And then finally, if a client is very angry, you've got to remember that someone who's experienced trauma and has PTSD is on red alert for danger and may be more sensitive to criticism and easily irritated. So when someone starts talking to you aggressively, it is normal to notice the tendency in yourself to feel defensive. But stop, pause and notice. Take a deep breath. And then talk calmly and softly to the client to de-escalate the situation.